Hi everybody, Dr. Molly here at Revitalize PT. I just thought I'd take a minute to give you guys a little bit of a sneak peek of some of the manual therapy interventions that we use to treat urge and urge incontinence. So here's a sneak peek of a bladder mobilization. Okay, so first what we'll do is find the bladder. So I'm just gonna feel right above Megan's pubic bone, feel for the first side and the other side of the bladder. And then I'm gonna just move the tissue to determine which side has more restrictions. And I feel that Megan's bladder is not moving to the left as well as it is moving to the right. So I'm just gonna have Megan do some deep belly breathing into this position. And I'm just holding the bladder stable and kind of mobilizing towards the area that has less motion, or away from the area, I should say. And the reason we do this is sometimes the restrictions on bladder mobility can cause symptoms of urgency or feeling like you have to go to the bathroom. So we do this mobilization to promote symmetry and mobility within the tissue in order to reduce symptoms.